Hello, I'm Justine and I'm reporting live to you with Dr. Rosen here, and we're going to be talking about non-Hodgkin's disease. Dr. Rosen, what is non-Hodgkin's lymphoma?
It is a diverse group of blood cancers that share a single characteristic in how they develop. Non-Hodgkin's lymphoma generally develops in the lymph nodes and in the lymphatic tissue.
Interesting. What are the symptoms
of this cancer is that you have cough or a shortness of breath. You also have extreme fatigueness, and you also get a pain in the belly and back.
What exactly is the diagnosis?
You can have a physical exam. You could also have different type of biopsies. You can have the chest x-rays. You could have a CT scan.
Frequency in population.
Population with people who live with this non-Hodgkin lymphoma is estimated to be about 500,000 people living today, and every year there is at least 100,000 people dead, if I'm correct.
What are the causes?
Lymphoma, the non-Hodgkin, the causes have consistent of weak immune system. They also consist of organ transplant, and they consist of the HIV infection. That's the bad thing.
What is the treatment?
There are many treatments to this cancer. The one that you will know the most is chemotherapy, because it is in lots of shows, and if you know people, then they will tell you, if they survive it, that they will get this treatment done. You could also have the stem cell transplant, and the one that I discovered was autologous.
What is the prevention?
Prevent non-Hodgkin lymphoma. You have to have immune deficiency. You must inject yourself, and you also must maintain your weight.
How many new information have you learned after your past years of being a doctor?
Choosing vaccination will help fight the treatment to make it better. So no more lymphoma. And then the chemotherapy, you get drugged up on Trianda.
Well, thank you, Dr. Rosen. That's all the time that we have. Tune in next time.
Thank you for having me on the show. Thank you for having me on your show. Susan?
Yeah.
For the